dear students, today we will see the parenteral administration. Parenteral administration. Previously you have to discuss about the oral route of administration. There is oral, sublingual, rectal administration, advantage and disadvantage. Last lecture you have to see. Now today we will see the parenteral route of administration. In this route, administration of drug so as intake directly into the tissue fluid or blood without having across the intestinal mucosa. With the all form of parenterals administration, sterile condition must means when you apply the all type of injections in this route, that site should be free from microorganisms. Nowadays you can use the syringe available, use and throw all the times. That's why the syringe should be the sterile when you apply that site, any part of the body. For example, intramuscular, you apply the 70% alcohol and then administer the drug. It means maintain the sterile condition. Now see the first advantages of parenteral preparation. Write down completely, don't write short. Not in examination is not allowed in the short forms. Now the parenteral route of administration, first advantages is onset of action is rapid because directly goes in the body tissue or in the blood and drug produce the effect very rapid. There is no any loss, 100% bioavailability on that route. The second, in this route, no destruction of the drug by GIT fluids and liver. Second advantage, in this route, no destruction of drug in the GIT fluid and the liver. Some drug should be taken orally, then the damages, they should be inactive. Such a drug given by that route, for example, insulin, oxytocin, always use the parenterally. The next third, it can be used for unconscious patient or uncooperative patient. This patient should be in the coma, they don't have any consciousness. Such a patient used by that route. This route used for in the emergency also. Right, next, fourth, it is commonly used in the condition of vomiting and nausea. You know the vomiting and the nausea, it's a common. Such a condition you can use such a route in this route. Next should be the drug is not absorbed in the GIT fluids. Okay. Now these are the advantages. Next, disadvantages. Needs for sterile procedure for injections. It's a very common, you know it very well. Before the injection you have to, that site should be the sterile. Sterile means free from microorganism, and then drug is applied. That is a major disadvantage. It's a sterile preparation must. When you can take injections, chances to be damage the local tissue. Local tissue is damaged. Sometimes pains may be at the site of injection, pains or swelling may be occur. Third, self-medication is very difficult, not allowed. It is not possible to take the yourself injections. It's so difficult. For next, it is expensive. It is expensive because you require one injection, you purchase the one vial having the 10 to 20 injection dose. That's why it's expensive as compared to the tablet. Injection is so costly. That's why it's expensive. And next is last. This route is not safe as compared to your other route. As compared to other route, it is not safe. It is not safe. Now these are the advantage and disadvantage of parenteral routes. These always asked in the annual examination. Explain advantage and disadvantage of parenteral routes for 4 marks. 2 marks for advantage and 2 marks for disadvantage. Half mark carry for the each advantage. You may be write down the 4 at least advantage and at least 4 disadvantages. That like mark should be the distributed. Now the next, various form of injections. The parenterals, parenteral administration is having the various form of injection. A various form of injection means there are the so many type of the injections. Now the first you can see, that is one intradermal. The drug administered in between the epidermis and dermis, that is a two layer of the skin. In between that, drug can be administered, that is called as the intradermal injections. Intradermals, the drug administered in between the two layer of the skin, epidermis and the dermis, that is called as the intradermal injection. It is commonly used for the toxins, vaccine, local anesthesia, it is commonly used for the toxoid, vaccine, local anesthetic, or sometimes check the allergy. Some drug allergy, example penicillin. In this route, the drug should not administer not more than less than 2 ml, 0.2 ml. Drug can administer less than 2 ml, and that is very painful. It is painful. It is painful. Now the second form of the injections, subcutaneous. Maybe write down the SC, capital letter. The drug can administer under the dermis into the drug can administer under the dermis into subcutaneous tissue. The drug is administered under the dermis into the subcutaneous tissue. Absorption is very slow. In this route, absorption is very slow. It is used, this route is used for drug release long period. That's important. In this route, you can administer only non-irritant drug. And volume should be less than 1 ml, not more than 1. Okay, now the next route, intramuscular route, that is the next form of the injections. You know, it's very common. It's a very common route. Doctor always use intramuscular injections. It's very common. You know it very well. Now see the advantage. The rate of absorption is very rapid. When you can given the drug in the intramuscular, the rate of absorption is very rapid, fast, and also uniform. 100% bioavailability. The drug in solution, suspension, oil can be injected. You can use in this route by the solutions, suspension, You know very well what is suspensions. And oil can be administered in this route. It's important. Different route used for the different purposes. Earlier you can see, for example, intradermal use the toxin, vaccines, local applications. Subcutaneous use for only the non-irritant drugs. Now intramuscular you can use commonly all the drugs, solutions. You know what is the solution? That is a pure unsaturated, so clear solution. Suspension, shake well after use, and the particles, solid particle can dissolve, not settle. Freshly prepared is required, and oil you can administer. And their capacity of this route is major advantages is up to 10 ml you can administered by this route, up to 10 ml. Okay, now see the disadvantages. Irritant drug can cause sterile abscess, and the pain. Abscess, gut. The drug is administered irritant that cause the abscess, and pains is tremendous. But the next disadvantage is cause thrombosis and the necrosis. Thrombosis and necrosis. Cell should be dead because of the thrombosis and the necrosis. And the last, nerve injuries occur. Sometimes when injection is given intramuscular, nerve injury occur. Okay. Now the next injection form, intravenous. Intravenous injection. It's a common route. Drug can be administered directly into the vein, that is called the intravenous. Drug can administer directly in the vein. It goes in the blood, that's called intravenous. The large quantity of solution you can pass by this route. Advantage, very rapid. Onset of action, because it entered indirectly in the blood through the vein. That's why the onset of action is rapid. Immediately effect is produced. It is used commonly in the emergency conditions. Second, very accurate drug is given. Very accurate drug concentration in the blood. Accuracy is so correct. Irritant drug can be given by route. Irritant drug can be given by this route, intravenous. A large volume of solution can be administered. See the disadvantages. Next should be the disadvantages. It is not used for oily and insoluble drug. Second, it causes pain, thrombosis, okay. Now the next form of injection is intra. Various form of injections now. Intra arterial injections. Intra arterial injection. It is commonly not used. It is used having very limited use. It is used only in the treatment of peripheral vascular disease. Peripheral vascular disease or intra arterial perfusion. Perfusion of the drug, it may be given into the artery, to supply cancerous tissue. And thereby reduce the amount of drug reaching the normal tissue. Next should be bone marrow injection. Bone marrow. So many pictures you can see. The actors suffer from the bone marrow cancer. Drug can be used indirectly in the bone marrow. Next should be dermojet injections. In this method, the drug can be administered very high velocity. Through the microfine orifice. It's a very pain. It is painless, and it is used for mass immunization. Dermojet injection, the drug is administered. This injection is used high velocity. The drug can pass very fast in the body by micro orifice. The skin having the pores, micro orifice, that, and it is painless. It is increased commonly the mass immunization, increase the resistance. Now the next one, intracardiac. Intracardiac injection. Drug directly administered into the heart. When patient is having the heart problem, heart attack, drug can administer directly in the heart. In such a drug are used adrenaline. Now these drugs are stimulated. Stimulate to beta 2 receptor, and then heart is stimulated and working the increase the force of contraction, increase the rate of heart, increase the cardiac output, and increase the blood pressure. Now the next injection, intra-articular injections. Next form, what will be number? Intra articular injections. Drug can be administered in the joints. Body having the joints, that joints having the pain, that time drug can be administered by this route, intra-articular injection in the joints. Example, head row, cortisones injections commonly used by this route. Next form, intra peritoneal injection. Drug is injected into the peritoneal cavity. You know the peritoneal cavity already you have studied in the first year. Commonly it is used in the animal. This route can be used for in the animal. It can be given in the intraperitoneal cavities. Next should be the intracameral injections. It's new. The drug injected into the eye ball, that is called intracranial injections. And the last, intrasynovial, drug injected into joint fluids area, that is called intrasynovial injection. Now these are the parenteral route of administration. We have to see today advantage, disadvantage of parenteral routes and the various form of the injections is available. Their advantage and their this. You can prepare the notes very properly. Okay. The next second chapter is finished. Next tomorrow we will see the third chapter.